So, welcome to Negotiation Secrets with Dr. Gloria Esomeme. This is the number one negotiation podcast for professional women. In this show, we talk about topics that give women leverage to negotiate for the salary and work conditions they deserve. In each episode, we bring guests from different parts of the world, different stages in their careers, and from diverse backgrounds to share their journey and experience. I'm your host, Dr. Gloria Esomeme. I am an internal medicine physician. I have a master's in global health and a PhD in health services policy and management. In this episode, I have someone very dear to me, Dr. Globlan Yousf. He's a physician based in Nigeria. He obtained his medical degree and training from the University of Ibadan. He is the chief medical director of Ceylon Medical Center. He's the co-founder of Accessible Care for Everyone, and he's also a coach at 110 Academy. Well, Ahon, welcome to this show.
Yeah,
I've had
Gloria, thank you for having me.
yes, I've had guests on my show who are friends, some are people who are acquaintances, but this is very different for me because you and I go way back in 2008 when we were both interns in National Hospital. There's
Yes,
something I
yes,
used to say back then in National Hospital that because National Hospital was like the most prestigious hospital to work in while we were there. It was the
yes.
highest paying. So there's something I used to say if you are in National Hospital, it's either you knew where you were going in life or your parents knew where they wanted you to go in life. You don't just dabble into working in that place. So what was your plan while we were interns, Bella?
Okay, all right. So, right before I came, let me just tell a bit of story of how I came about National Hospital. So,
Yeah.
in my fifth year in medical school, we get to do this outside posting.
Yeah.
And one of or two of my seniors had done outside posting in National Hospital, and they were like, "Oh, it's possible you can write and all." So I wrote, and I came to do 4 weeks in National Hospital, and it was at that point I realized that, see, this is where I'm coming back to do my internship. And it wasn't that easy because it's not like it was because we had to write an assessment, but eventually I got in, and it was a beautiful experience. But by the time I'd come in, I already knew that I was going to do what I'm currently doing now because I had an experience in my fifth year that I want to start my practice and all of that. So coming into National Hospital was to the final step in learning the trade, getting as
I
much
see.
skills as I can. And I saw that shortly after I know that, see, I'm going in to start my practice.
So what was the experience you had in your fifth year
Oh,
of
okay, yeah.
so,
So
so when you say you
yeah,
had
yeah,
an
yeah,
experience
yeah. No.
in your fifth year, that means your experience in your fifth year in medical school at UCH, right?
Yes, in medical school, yes, at UCH, yes. So, well, of course, while we're going through the training and all, one of the things I thought about, and I think I went for an outreach where, medical outreaches are where medical organizations or NGOs, it's like you're taking the entire hospital to the people and trying to help them. So I was part of the medical team who saw the patient, prescribed drugs and all. And then on the first day, I think I must have seen about 50 people.
Oh,
And then
50.
I got home and yeah, yeah, 50 years. And I got home, if I was literally tired and all, my hand felt like it was going to pull out. So I go home and I started to think about it. And then I realized that, see, no matter how good I become as a doctor, I'm limited by the fact that I'm just a man. I can't see only as much as I can, as much as time
Mm,
and space will allow. Yeah, but if really I want to live like a life of impact and all, I probably have to set up a system where I can multiply my effect through an organization. And that's when I started thinking about starting a practice where I could also train or get other doctors like myself, to help as much people as possible, of course, and also as I found out, run it as a business itself. So that was the experience in my 50, and it started to change how I saw my practice. Started to change how I thought about myself beyond the medical training. So that was the experience I was talking about.
it's- that's interesting. So when I was in my fifth year, all I was thinking about was, oh, I'm gonna move to America for my master's in public health. That was my because for me it was my fourth year in
Yeah.
medical school. I was maybe fourth or fifth. One of those two. I was doing my children emergency room rotation, and I was
Okay.
there. because you can still hear what someone was saying in the other room, because we don't have like private wards. Even most ERs, they don't have like private wards. So I
Yeah,
was listening. I'd done asking my patients their questions, and I could hear someone asking. I was like, yeah, I know what they're going to ask next, and they asked the question next. I'm like, I know what you're going to ask next, and they did, and I'm like, I don't think I can do this for the rest of my life. It's so there's
yeah,
little, once you understand what you're supposed to do, it becomes very monotonous. It's what I would enjoy, is just the interaction with the people, because each person is different. So that's when I was like, oh, I think I want to do public health, where I can reach out to people more, where
yeah,
there's something different every day. And then, so when I got to National Hospital, it was all roads lead to America. And most of the people who we worked with, like, Chioma, aka Halima
yeah.
Karim, most of
A
the
good
people, they're
number,
all
a
the
good
good
number of
numbers.
people were
So how
on their
come
way out.
you never thought of leaving, and you haven't changed your mind about leaving Nigeria, considering the whole situation? What has kept you going?
Yeah, I think so. Like I said, well, at the core of everything I do is actually impact and try to help. And I feel that because of my own leanings and preference and things I see in the community, I try to fix. Most of the place I could do most of my impact is right here. And then at over, like we say, we're talking about 60 years ago. So over the past 16, 15, 16 years, I've been doing that and building that. And then it's been good. It's gone so well that, I've seen the result of the things we're putting out there. And also I know that not everybody would leave. Some will actually have to be here to continue the work. And then you guys will come back at some point. And
I,
then
I,
you
I,
have us here to connect to what's
yes,
going on here.
I'll be
And
happy
then it
to.
can help.
I'll,
Yeah.
I'll be
Because
happy.
like I believe is we all would help, but at different level, different scale, and from different point positions. Yeah. So for me, I've actually lived a life of passion to help people here in my communities or wherever I find myself. There's so much about what we expect governments to do and all. Yes, free healthcare, subsidized healthcare, all those are things you expect from government. But Nigeria is populous. Look, our numbers is so massive. So I also feel that private individuals could also, connect to what they're doing and in their own little space. It's like you have your impact in your small space and you have a lot of people like that. All of that can come together to actually help lift the face of healthcare in Nigeria. So for now, yeah,
Yeah,
yeah, yeah, I'm still here. But of course, uh, the plan also is because I'm human, I also should enjoy it and see. My plan is not to read just one page all my life. Yeah, so we also take time to visit other countries and see what's going
countries,
on there,
of course.
vacation, relax, and all, and then still come back.
Yes. And the world is getting smaller with each passing day.
Yeah,
It's becoming a global village. Something happens here, everyone knows at the same time. There's no time lag
exactly,
between when information transmits these days. You were talking about
exactly.
impact. So what's the biggest impact you've had that you felt very proud of your work? Like you did something, and then you look back, you're like, you know what, I'm glad I was here.
Yeah. Okay. Yeah. So I think I'll just stick. We said biggest, so I should say one. But I'm not sure if you saw that last year. I turned 40 last year. And my decision at the time was rather than have a party because I didn't feel like it, not like it's wrong to do that. I decided to put out a post where I was looking to do 40 free surgeries. And then it blew up and we got over 2,000 entries. And that showed me that we had a lot of people who actually needed a surgical intervention in one way or the other, but probably couldn't afford it. And then we ended
Wait,
up doing about 53 surgeries.
you wanted to do 40 surgeries, and you had 2,000 people
40
apply.
years surgeries. Over 2,000, yeah. Apply, yes. Apply, yes. It was really humbling for me and it showed, the amount of the need, the great need for such social interventions in the country. We ended up doing about 53. But the beautiful thing is that a friend of mine who turned 40 later in the year also reached out and then said he wanted to also sponsor another 40 and we collaborated. I think we did another 50. But the
Oh,
goal at
wow.
the time was to go to 100 surgeries. So last year we did over 100 free surgeries. And then that's something that we've taken lessons from that, and then we're working currently on also coming out. Now, that was me, that was my friend, but coming out as an organization with the NGO that I also run to actually do something much more in that aspect. So that's one thing I think I've done that was really big, and then started out small, but ended up very big, and I'm happy for every because this year during my birthday about 30 of them actually reached out to me to say thank you because they will never
Wow.
forget my bed because that was what led to, the
Right. That
solutions
was that
which
was the
I've been looking out
gift.
for. Yeah.
Wow. My 40th birthday, I did not do anything that great. I was looking out for gifts. You are inspiring me. You are inspiring me. So maybe we could think after this conversation. We'll think of ways we can partner so I can be a better person. You are inspiring me right now. We'll talk.
Oh, definitely.
Um, but
Oh, definitely.
to run a practice at home, you need to. It's not you're not. I know you have a non for profits, right? But to run a practice, you need to
Yes.
make money. And you said something about the government
Exactly.
not being able to produce, but in America, the government barely, a few people have social insurance. So a few people are on Medicare and even Medicaid, and people are on Medicaid and Medicare, and even Medicare. For you to be on Medicare, it means you gave into, you paid for it. So it's technically not free, but Medicaid is free
Yes.
to a certain extent. So there's almost no free. Maybe the UK has free healthcare. America healthcare is very expensive. Someone could have
Yes.
one illness that's catastrophic, and you become poor for the rest of your life. You go on admission. At the end of that stay, you may end up paying $150,000 just for one hospital stay, for one surgery. Healthcare is
Oh,
very expensive in America,
oh,
so I don't
wow.
expect it to be free in Nigeria. I don't expect, but it's a different entity on its own. However, for you, you're running a private practice, right? You need to break even, you need to make a profit. So do you have any guilt around making that profit, and how do you manage? Because from what you said, you wanting to start that, to have a hospital, did not it was not a business idea. It was just that normal heart of a doctor that we had going into med school. I want to help, I want to make a difference. But in trying to make a difference, there also has to be the financial part where you're giving, you're still filling your cup so you have enough to keep giving. So how do you create that balance?
Exactly. It was a journey that I had to realize that yes, you want to live a life of impact, you want to help and all. But I learned also before I started the practice that even as an individual, if you don't if you don't have enough and extra to give, soon you will be like the people you're trying to help.
That's correct.
So yeah, yeah. So I learned that I have to get myself to a point where I'm strong enough to stand for myself, then I have enough to give. And that's how the
Right.
practice also evolved because we started the hospital, Ceylon Medical Center, in 2014. And of course, we offered our services at really affordable prices, thinking that, okay, it's a business, it must earn the profits. And then, but that attracted a lot of people who didn't have. We had other programs around, even when around our day-to-day practice. And within this first 6 months, I realized that if I continue like this, I'm going to run this business to the ground.
Yeah.
And that's what also helped the founding of the NGO, the non-governmental organization that the business also contributes to. So I think that
And
helps the conscience that okay, the business should run as a business, should
business.
make a profit. However, the cost of healthcare when you come to us should still be really reasonable compared to other hospitals in the area, but you run as a business, you make profits, should be able to take care of the staff, be able to take care of overhead, should be able to save and profit for even the owners of the business, but also should have a
Correct.
percentage that goes to the non-profits and have the non-profit take care of the social impact, the CSOs and all the other programs that reaches out to those who cannot afford. And I think that was the game changer for us, separating those two. So it was easy to
That,
deal with the business as a business and the non-profit as a non-profit. And then
so how do you,
to add to that, it was now okay.
no,
Okay,
go
the last thing
ahead.
I just want to say, it was not easy for others to come and partner with us because it was easy for people to partner with a non-profit than to a business that says it's doing some social impact because most people feel that you're a business, you're making profit. Why should I give to you? You understand? But it was
Correct.
easy for them to give to the non-profits, and that also improved the amount of impact we're able to actually have in the communities around us.
Wow. That was a smart idea. How did you do you have mentors or how did you come up with this idea?
Oh, okay, yeah. Yeah, even the part of my fifth year that I didn't tell you about was, so I have a mentor, and I've known him because for in some way, he's friends with my dad and all, but I've known him from a distance. And then he finished from UCH too. And I think the fact that I was studying medicine usage also kind of brought us together. So we had a conversation also in my fifth year, and then he had asked me what did I want to do after school. And because he's an alumni of the school, and then bulk of the conversation is you finish, you go do a master's or do a residency. And I didn't want to get on his bad side. So I just told him,
You're
see, I
right.
want to go do residency and all. And he looks at me and like, see, I know you, I know, and I don't think that's the next thing you should do. And then he started to talk to me about what I already had in mind to do. So it was kind of like a love at first sight kind of thing. We kind of gelled. Yeah, because he
Of
was looking
course.
at like he needed to convince me to do what I already had in my heart to do, but I just didn't want to
He was
say it
speaking
to him
your
because it
language.
wasn't at the time. You understand? Because at the time it wasn't like the popular thing at the time. So and that was the beginning of a very beautiful relationship I have with him, even up till now. So I joined him and then I learned firsthand how to actually run a profitable hospital. You understand? And
Hmm.
then he also had one or two programs that he was doing at the time to also help the people. He also has a non-profit, but his non-profit is a bit different from how what we do and what he does. You understand? But he also has a non-profit. So he kind of had the things that I'm doing right now. He has the things that I do right now. So I learned those things from him. And when I started, when you start your business, you have your own challenges, and then you look for your own solutions which might be different, but
Correct.
having him with me from beginning was a very good foundation to start. Really helped me stand. In fact, I was set up to succeed because I learned a lot from how he had done and succeeded in carrying out his own business and practice.
So it's not like you told me you had a mentor, right? But when you were describing what happened
Yeah,
and you said 6 months into it, I knew it was smart, right? Well, doctors were smart. But I knew it had nothing.
yeah,
It was not absolute, not nothing. It was not absolutely based on your smartness. I can smell and see mentorship in someone's life because of the mentorship is one of the best things we could ever have in life because what it does is that it helps
exactly.
us keep so many mistakes. People who have gone before us, they can look back and say, hey, don't go through that road, it's going to take you longer, why don't you skip this? And it's also good for us to be humble enough to know I need a mentor because some people are not mentorable. You know how they said, I don't know if you remember, if they used to say that in your medical school, they say you're not teachable or educable. That was a word we used to use in my medical school
Yes,
when they
exactly. Yes, yeah, yeah,
so you need to have that humility to say, okay, I need someone to show me the ropes. I really don't know how to navigate here. I need someone to show me the ropes. Mentorship is one of the biggest things we could ever have. Having mentors and sponsors. I think I did an episode where I talked about mentors and sponsors and how they can open doors for you. So back to your private practice. So how many practices do you have now? And how many doctors work
yeah.
for
Yes.
you?
So I have two practices, and then we have across the two practices, we have two doctors. They actually
Wow.
work, sorry, five doctors. So we have three doctors in one, then two doctors in the newer practice. So those are the ones that work for me across the two
The
practice.
system. So, with all the doctors wanting to leave Nigeria, so how do you keep yours? How do you keep your doctors?
So that's a major challenge. It's better now, but I think around 2021 to 2023, it was quite difficult to get doctors, but well, I'll say lucky, and also we create. So in my hospitals, I proudly say the least anybody that works with us would get is the salary, because I
Gotcha.
understood the importance of having a mentor in my life. So if you sign up if you join my hospital, you are signed up to get a free mentor, and I'm really going to mentor you, either you like it or not. So yeah, so we're built up to actually develop each of our staff. And then if you're the
Gotcha.
kind of person who has, a sense of purpose, and you're actually determined to do something out of your life, when you come into that environment, you get to learn that early. We pay well, but at the same time, there's things around us that ensure that you're getting better every day. And I think that also adds to the satisfaction of the right kind of people. You understand? So they
Correct.
know that, okay, I'm here for it. And then for us too, we accepted the fact that we might not have doctors for forever. So doctors are also on the journey, probably want to also leave the country, they're writing their exams and whatever. So for the 1 year, 2 years that they're going to be with us, or 3 years, we want to ensure that they have the best of times, such that when they go away, they always remember their time with us to be good. That's one. Then number two is they can always recommend their friends who they love and know that would
Mm,
enjoy what our system is like, to also, of course, take over from them. So that's what we do. So the turnover of doctors, we really couldn't do much about it, because, like I tell people, we're not competing against doctors in Nigeria. Sorry, hospitals in Nigeria. We're competing with hospitals outside the country, and what
correct.
the promise of what all of that gives. And I can't offer that because I can't solve all the problems. So we are kind of accepted our faith, but ensure that for the ones who are here would really want to work with us and stay with us. So that's what we did around the time, and we're still doing currently.
No, I think that's really great. And it's not just for your practice, because in life generally there's always
Yeah.
competition for good talent. So
Yes.
it's even if you were in a place where you were not competing with like the bigger organizations, bigger countries, you also want to create an environment where the people who work for you would have a memorable time and say, that was the time I had one of my highest growth. That's what one of my mentors tells me all the time. She says whoever works for her, she wants them to remember that that was the time they had the highest growth in their lives. So I think that's a very good
Exactly.
business model, where when you have people work for you, especially when you can never be the highest payer, there's always someone who can pay someone more. There's some things you can't
Yeah,
control,
there's
but one
always
of the things you
someone
can control
doing
is how you treat.
something better than you. Yeah.
Correct.
Yeah.
So
So
I have
and
another question for
looking at
you.
it, and because we need that. Okay. Okay. I wanted to say something before
No, no, no,
maybe your
please,
next
no,
question.
please tell me what you're going to tell me. The
Uh,
question is still here. I have it written
okay.
down. I'm going to read it out.
Yeah, and probably my Okay, it might be answering your next question. I don't know. Anyway, now because we also know that we knew the reality of the country of skilled personnel, and they're moving out. Now, knowing that, one of the things we did, and I was doing with doctors, is not to shy away from that reality, but to have that conversation with them. So, like when we talk about negotiations, because I know that they have one eye here and one eye outside the country, I knew that I had in every conversation bring the value that I have, and I'm introducing to them, and bring that value into almost every one of our conversations, so that you don't wait they might never come to you to ask you, and because you might feel that, okay, this is what I bring, so my organization is to help you grow and all of that. You are not silent on those things. You bring it to the fore in one form or the other when you're having conversations. When I was having conversations with them, so that, and also help them track the fact that, see, when you go here, this is who you are. Yeah. So I had to show them where they were when they joined, and 6 months where they currently are with us, and then be able to make them realize that we had a part to play in that, and wherever they might be headed, the longer they stay and then they apply themselves in all the things we're doing, the better they would become, and then it improves their chances as life goes on and on. So it was important to actually bring that, and understand that, see, I have to continually negotiate their continuous, involvement, dedication, and all of that, and staying with me. I think that also helped at least a good, we're different, and what
Of course.
motivates different people, differs. But for the kind of people that I was looking out for, it made them stay even maybe a bit longer than they naturally would have. And even when they left, they brought in, like I said, brought in their friends who they know would benefit from staying with us and all that.
You know what I heard you say two things. The first thing I heard you say was you made sure the people who you got into your organization were people whose values aligned with yours, right?
Yes,
And then the second thing was that you continuously articulated to them the value you were adding to them. You see, most of the
exactly.
time when I talk to people, it's the other way around, right? I'm talking to women because I teach women how to negotiate. I tell them, when you are working somewhere, the people of influence, let them know what you're doing. It doesn't mean you're being arrogant. It doesn't mean you're, no, you are letting them know your value, because sometimes when you don't tell people the value, they don't realize your value until you tell them. And now to see it coming from the other side even makes it much more important, for because you have the power, right? You are the employer. You could say, you know what, I don't
Yes,
want you
yes,
anymore.
yes, yes,
Imagine someone who has the power clearly articulating the value he adds. How much more you, who is an employee? We see, as an employee, you still have some degree of power. You can walk away, but you
exactly.
also have to articulate the value that you're adding. You can, whatever you've achieved, you can say, hey, when I came in, this system was not in place. This is what I've done, and this is what I'm planning to do. I think that's just
Yes.
genius.
Yes, and to just add to and to give some credence to what you tell employees. I've had employees walk into my office and then demand certain, maybe a pay raise or some things, and I had to listen to them because they have shown over the years how valuable they've been to my team. And then, so what I naturally would do is when I identify such people, I ensure that long before they think about, you need to give me a bump in my pay, actually give them a pay raise, because we don't just increase pay because we want to do that. Generally, we do that sometimes, especially when you look at the economic situation of the of country and all of that. But there are some employees, as members of my staff, that actually get a pay raise 2, 3 times a year because of the value they bring into the organization. And when I don't do on time or not as much as they like, they come into my office and have a conversation with me. And then I'm forced to actually speak with them because I understand I'd rather keep having them in my organization than have them go some work for somebody else. So it's
Yes.
important you have the value, and then you can go into meetings to discuss and say, this is what I have. In case you have not noticed, this is what I've been doing. All these things you've seen, it's all me,
It's
and I
all
think
me.
I
Yes.
deserve better.
This is powerful. I knew this was going to be a great conversation. I knew I was going to have so much information to pull out of you to reinforce some of the things I already know, and also to learn new things from you. So this podcast, you know what, before, this podcast was called Negotiation Mastery, but this is the first episode where
Okay.
I've changed it to Negotiation Secrets. I changed it because there was
Okay.
another podcast that had the same name. I was just like, let me
Okay.
just call it something different. So this
Yeah. Yeah.
podcast is called Negotiation Secrets. And what we do is we teach women how to negotiate.
Yeah.
Because for you, you run a business, you run an organization. And so there are so many times you would have to negotiate. Sometimes it's negotiating with your employees, sometimes it's negotiating with an outside organization when you're making purchases, when you're creating partnerships. So what is your number one negotiation secret?
Okay. So I think for me, and because I've seen that every time I've had to negotiate, is I think it's important to believe in what you're trying to get. Confidence is very important. And let me explain what this is. Now, anytime I'm having a conversation, and it differs, from points from person. So when I'm negotiating with vendors or people who will get products from and all of that. Now, I negotiate from the standpoint of what we have done as an organization. Because when I mean confidence and belief in yourself actually helps you be a better negotiator.
Of course.
Yeah, and the way, like, let me give you an example. The way I would negotiate, or I negotiated when we just started out with vendors, is different from the way I negotiate with them now.
Of course.
Yeah, because when I started out and I wanted to do a few things, I got a lot of pushback. And what I told myself at the time was that, see, they don't know you yet, so they cannot respond to what you're talking about. Sit down, keep your feet on the ground, do the work, let them see the value, then come back to talk to them. Then they will listen. And what happened simply is that I didn't even have to go to all these people anymore. They
They
start
started
to
coming to
disturb
you.
me. Please, I get mails every Mondays. I get messages every Mondays. Everybody's coming. They want me to put their products on my in my hospital, in my pharmacy, and all of that. So I think the most important thing is the confidence in yourself and in your worth. Because if you believe, like, and I think it comes back to value, if you actually trust what you have and what you're able to bring to the table, I think it builds your confidence. And then you can sit down and ask for whatever you actually want. I'll
So
give okay, I want to give an example of sometimes you actually people value you a lot more than what you but than yourself. So there was a time we needed to get I'm trying to remember what exactly. Okay, let me use this example. So there was a time we had an issues where we leased for the hospital, and then the owners were asking for so different funny issues, and then owners were asking for more money, which was way above what the going rate would be. And because we had issues over 2 years, I started to think, okay, I think we should get our own building. I think we should get. It wasn't like we had all the money to get a place, but then I think, and luckily on the same street, there was a house that was for sale. During at the time, we didn't have money to buy. But one thing I knew was that, see, we would go, we have a steady income, we generate sales every day, every month. The least that would happen is, see, I can pay this and then spread the payments over a period of time. And that was how I started the conversation. And I think because I believed so much in what I was going to offer, I didn't think about the fact that if they were going to accept it or not. I didn't consider the fact that some other person would probably come with all the money and pay.
cash ready.
In Nigeria it's different from over there where you can mortgage and all of that. You have to pay
Correct.
upfront. So, and I started the conversation and we started to negotiate. And then each time, okay, the first thing I did was say, let's see how I can draw out this negotiation. They started from a fee. We had to negotiate until we get to a particular amount that I felt we could pay. And then the next thing was, okay, go ahead and pay. And then we started, and I was initially trying to, and I just put it out there that, see, this is what we have now. And we're going to pay you this after, I think, 3 months. And surprisingly, they said, no problem. You go ahead and do that. And that's how
So
we closed that deal.
wait, so first of all, your strategy was you didn't tell them what your payment plan was. You first of all went in
I
there
didn't.
and negotiated the
I went
price.
in. Yes, I went in confident that, see, we want to buy. I have the money to buy. So when we got to an acceptable fee that I felt we
Then
could was reasonable for them, and then we could pay, then I came out and said, okay, this is my payment plan. Do you
so what
understand?
I
And
yes,
then
because I think go ahead, go ahead.
yeah, yeah. So and I was surprised when they said, okay, no problem, just go ahead. And let me even tell you, so I paid the first part, and when it was that time, I couldn't pay. But I knew a few weeks before the deadline, I told them, please, I need to extend it by just 1 month, 1 month. And they said, no problem. And we paid and then moved in. I think about 3 years ago, we moved in into that thing. So
Beauty.
one of the things I learned there is, see, you never know until you ask.
Ask.
You understand? You never know until you ask. So the first thing, be confident in your value, because you don't go to I might be saying a lot of things, but they still center around one thing. You probably would not go to a negotiating table being the weaker party.
Yeah.
It's better when you're the stronger party. You have something to offer, something they need. You understand? You want to get something out of it. So when you go as the stronger party, or you have something to offer and you believe and you have confidence in what you have, it helps you when you're negotiating, because negotiations and is not just verbal. There are non-verbal aspects to negotiating. If I'm negotiating with you with an employee, and then I can read if the employee is not so sure if he or she is going to get what they're asking for.
For
And if I feel that, okay, that, oh, I don't think they deserve it yet, I feel that I can get away with turning them down or
yeah,
coming to some agreement that is lower than what they asked for. But I can also see in someone who is sure of what they're asking for and they
yeah,
know
like
that they deserve that.
I
Then you
have to
know
agree.
that, see,
This person is gonna give me so
you have
much
to
push.
agree. It's going to go, yeah. So I feel it comes to for you to come into that room and you're that bold when you're talking to someone who calls the shots or who is
Yeah,
superior. Because I'm explaining that because when I say the stronger party, it doesn't really have to be in terms of authority, but in terms of what you're negotiating for.
yeah. In terms of
Do
influence,
you
yeah.
understand? Exactly, in terms of influence. So you go there with all the influence and you can go in with that confidence and then ask this. And then if the conversation draws out, you can then tell them these are the reasons why you feel you deserve this. So I think for me, do the work, build your value, be valuable. I think that's the secret. Now, not just staying there because you might be valuable and be too timid to demand what you're worth. And that's why I brought in the confidence in yourself and in your worth, and then
Correct.
go in and then have that meeting, have that negotiation, and then hopefully it becomes successful.
Let me tell you what I heard you say. So what I heard you say, number one, and it's what I heard you say and what I inferred from how you got your building. Number one is know your value, know what
Exactly.
you're offering, and then number two, develop relationship. Because from what you said, I think all the meetings you had going back and forth trying to negotiate a price, there was a relationship that was developed between
Yes.
you and that person. They knew you, and maybe, well, you're a likable person. Everyone liked you when we're doing our house job, so they knew you, probably got to know you and liked you, and then you made your
Yeah.
ask confidently. So know your value, develop relationships, and then ask. You never can tell. The worst that can happen is
Exactly.
no.
No, yeah. And no is not the end, it's not final.
No,
No
it's
is
not
not the
fun.
end of it.
No, it's
It's not
not.
final.
It's
Like I
not. Like
told
I
you,
said,
I said early
come back,
on, I'd asked for things and they said no. And I said, go build your value and come back.
come back.
Do you understand? So no, it's not
Wow.
final. Yes.
Wow, 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 wow. That's a master class on its own. Like what you just dropped there is just, if anyone can really apply that in their life in every situation, you would grow in leaps and bounds. You would amaze yourself, because if you don't ask, you can never know if they're going to say yes or no. And people are just scared. They're like, oh, when they ask, because there was a meeting I went to. There's a girl who was there. She said, oh, there's someone I'm trying to invite to an event, and what if that person says no? And I wasn't on the panel, but I just asked them to give me the mic, please, that I need to address this real quick. No means no means nothing. You say no to me, that's
Yeah.
fine. I'm going to ask the next person, and I'm going to ask you again when I think things have
Again,
aligned.
yes.
Yes. Wow. So what's your plan going forward? You've done a lot. So what's in the plan for what's the plan for the next few years?
Okay, yeah. So, well, I have plans for different things, but let's talk about the hospital and the non-profit.
Yes.
Think for the hospital. So we where we are now, where we started off being more like offer primary care or primary level of care. But now we offer a secondary level of care because, like I said, the goal from beginning was to set up a system where you can bring it and leverage on the strengths of other people so you can multiply the effect. So where we are right now is so we have specialists who come in and offer specialized care in our hospitals. I planned, well, I wouldn't say that that plan is dead because I plan to actually set up a good number of hospitals. And then, well, I'm thinking about that, but I think we can go on and then put a few more in Nigeria because I felt that personnel might be a limiting factor when we had a lot of doctors, nurses moving out. If you have a lot of hospitals and you don't have doctors and nurses. But the reason why I believe that we can move on is that we've set up the system I just talked about. It's quite effective. And I think with that, we can actually get more people in and then help as many people as possible. Then also, I'm thinking in a few years, probably look into another sector of business. Like you, I said, I'm a business coach. So the hospital is the business of healthcare. And then as a person, as a family, we're also looking at, diversifying into other sectors. and then also of course make business and all. That's on the side. For non-profit, non-profit also is looking to expand their reach beyond. We've
Okay.
done most of our work in Lagos. We're expanding our reach to the southwest and the other parts of Nigeria. And that's looking into collaborations and all of that. Also look at other organizations because there are a lot of people who want to do a lot, but they're looking for credible non-profits to actually channel their funds such that they can do a lot of things. So we're looking at that. We've done as much as we can. A few friends have joined us in doing stuff. We're looking at other organizations who are really looking into this to also collaborate with so that we can spread.
So if people want to, so if my listeners or we have friends, because I know you and I we have lots of mutual friends. So if our friends want to give to your
Yes.
non for profit, how do they do that? How can we give to your non profit?
Okay, yes. So what I could do is also share you so they can reach out to us. We're email. So the nonprofit is Accessible Care for Everyone initiative. On most
Okay.
of our social media platform, you see that ACE initiative. It's on Instagram, Facebook, most of the social media platforms. So I could also drop the email of
Okay.
the nonprofit so they could reach out. We have staff that would actually reach out to them, and of course, our mutual friends can reach out to me directly, and then we can look at that. So that runs on its own, and then my wife actually we co-founded it, and then she helps to
To
direct and all the administration and all of that. Yeah, so they can actually reach out and then look at the programs for. So we even have a program happening in that's the first Saturday in October. That's on the 4th of October. So that's like a medical outreach in Lagos where we're looking at, attending to over 500 people, offer free healthcare
five
services and
hundred.
all of that. So yeah, we're looking at 500. So the hospital and the non-profit civil medical center and ACE initiative are looking at that. So we have a few programs like that. That's when people reach out, we could like, okay, this is what we're doing, and then they could either key into those programs or say, okay, we want to give this to you, and then like what we do, and I think a lot of people want that is to give you a report of what is being done, and of course
Correct.
right now that you have to show evidences there because sometimes some people get this and then push into some other
Something.
things. So
Yeah.
so if they want to reach out, they can reach.
Thank you so much for listening. I have three asks for you today. Normally, I would ask my first ask will be based on the conversation I had with my guest. So this, I think, what I like the most is impact. So what I want you to do this week is look for an area of impact that would make a difference in someone's life. So be more. It's just that spirit of generosity, which at the end of the day, it fills you up and makes you bigger. So look for something of impact that you can do. Then the number two ask is I want you to like this episode. I want you to subscribe and I want you to share. Let's build our community. Let's have this strong community of women who know how to negotiate, who know how to ask for what they deserve. And then the third thing is if you are looking for a speaker, if you have an event and you're looking for a speaker to rock your stage, I'm the person for you. Reach out to me, send me a message, and I'll be able to, we'll communicate and we'll come up with a plan. Thank you so much. I really
You're
appreciate
welcome.
all the nuggets you've shared with my audience. Thank you.